Hello everyone, it's been a while. I've been busy, but I'm here today to talk about something very interesting. So today, let's talk about abnormal vaginal discharge. In my last video, I told us that we'll talk about that. And we are talking about vulvovaginal candidiasis. That is candida of the vagina. Some people will call it yeast in the vagina. I started talking about it in my last video. I just give something like what we call an introduction to vulvovaginal candidiasis. So today I'm actually going to talk about risk factors of vulvovaginal candidiasis. What we can say that if you do this thing, there is this tendency for you to have what? Vaginal candidiasis. So now, before then, have you followed me on my page on Facebook, STI and Female Health Matters with Dr. Tinuade? I'm on YouTube as well. You can subscribe to my channel, Dr. Tinuade on sexually transmitted infections. Dr. Tinuade on sexually transmitted infections. I'm on TikTok. Just type my name. I'm on Instagram. Just type my name and follow my page and see my previous videos, because I've talked about normal vaginal discharge in my previous videos, so I'm not going to talk about it now. But let's talk about vaginal discharge. The one that you see in vulvovaginal candidiasis is thick, it's cheese-like. If you are familiar with pap, after soaking your maize, you grind it, you sieve it to remove the shaft. So that shaft, how it looks, Yoruba call it airy. That's what you see. Is this cheese-like thing. That's how the discharge in vulvovaginal candidiasis, that's how it looks like. So now we are talking about the risk factor. What are those things? Maybe when you do them or when you have them, there's tendency for you to have what? Vulvovaginal candidiasis. So let's start from pregnancy. When people are pregnant, the immunity, that thing in the body that can fight infection, is very low. Because I want us to talk like talking to the public. So immunity is very low. So in that way, it's possible for that person to have vulvovaginal candidiasis. Then people that have cancer is one of those reasons to why they have vulvovaginal candidiasis. In fact, people with cancer can even have it in the mouth. The same thing with HIV when people have it. So sometimes when people come to the hospital, what they come for to get treated is vulvovaginal candidiasis. But by the time they come and we start investigating, we now get to know that, oh, they have other things. And that what I'm saying is that especially recurrent vulvovaginal candidiasis can be a pointer to something else in the body, a disease that is more severe in the body. For example, now, diabetic mellitus to diabetes is one of the reasons why people have vulvovaginal candidiasis. And we have many patients that it is the vulvovaginal candidiasis that is irritating them. That was why they came to the hospital. And eventually we got to know that they have diabetes. In fact, a very bad one. So I'm not sure. I'm sure many of us would have of diabetes before this thing that happened to people, that sometimes you get thirsty a lot. You go to the toilet to urinate more than usual. You have weight loss, and you don't even have, sometimes you don't have anything. Some people always come with the complications. When the complications set in, that's when they know there's diabetes. But I'm not here to talk about diabetes today. I'm just trying to tell us that when you have things in your body, come to the hospital. Don't just go to the, because I know a lot of people, they just go to the chemist, they just give the, and it's 13. Everybody knows that. They just insert it to say, they have toilet disease, all those things. So what I'm saying is that vulvovaginal candidiasis can be a pointer to so many other things in the body. For example, it can be a pointer to cancer. It can be a pointer to HIV. It can be a pointer to diabetes. So because those things are part of the things that make people have vulvovaginal candidiasis. Then, when you are somebody that, if you take steroids, some people take steroids, especially people that have asthma. Some of them take steroids. But after using steroids for a long time, there is tendency for you to have what? Vaginal candidiasis, start itching, the discharge will start coming out. It's very uncomfortable. Then people on chemotherapy, those are drugs that they give people that have cancer. When people are on those drugs too, there's tendency for them to have vagina candidiasis, because the immunity is low and the drug is not even helping matters. It help or weaken the immunity the more, so they can come down with vulvovaginal candidiasis. The people that like using antibiotics, because what happens is that by the time you use antibiotics, the antibiotics will kill the normal bacteria in the vagina, so it will allow candida to grow. So maybe you like, some people just headache like this, they would have gone to take maybe Ampiclox, amoxicillin, those drugs. By the time you are abusing antibiotics and use it a lot, or recently chronic use, illicit use, there's tendency for you also to be coming down with vulvovaginal candidiasis. And you see, there's something we call recurrent vulvovaginal candidiasis. What it means is that some people, like in a year, they will have like 4 or more episodes of vaginal candidiasis. There are some people like that. Some people have it, and people will say, oh, maybe it's genetic, maybe it's something that it has to do with family history, that's how their body is made up and like that. But some people, it's because there's something else in their body. So that's why it's always good to come to the hospital. Now, Candida like places that are warm, humid, that there is water, and those places that are warm, it grows in that people. In fact, some people, they have Candida on the fold, that fold that is beneath the breast. You see Candida there, that place is just white and itchy. And that's why obesity is one of the reasons why people have vaginal candidiasis as well, or Candida even on the skin, other part of the body. So now, about this wetness, so that's why wearing of tights, especially nylon tights, we give that kind of environment in the vagina, and it will help Candida to grow. And that Candida, some people will say yeast, some people will say fungi, but ideally Candida is a fungi in that classification. So when people wear that, some people like sitting inside bathtub, they feel cool, they just sit there naked. Those things, they help Candida to grow. So they are also risk factors for vulvovaginal candidiasis, the candidiasis of the vagina. Then people that go to swim, some people go to swim, they will not remove their swimming trunk on time. They will stay in that wet swimming trunk for a long time. That can predispose to vaginal candidiasis. Some people like wearing wet pants, especially our youth, that they would have they will not wash their pants. Maybe they use all the pants, they are dirty, and they just want to do overnight washing and want to wear the next day. By the time you start wearing wet pants, and it's like a habit over time, you will start having vaginal candidiasis. You start having that. Then apart from that too, when you wear nylon pants, nylon tights, it gives that kind of environment too, warm, humid, and Candida will start growing, and you can start discharging, itching, and like that. And some people, they don't even have much of the discharge. It's just the itching. Itching can be very bad. And you say, they have toilet disease. No, many times it's vaginal candidiasis. And that brings me to the issue of sex. Actually, we have not classified vaginal candidiasis as sexually transmitted infections, vagina or vulva. Some people, you would have been seeing me say vagina or vulva. Vagina. I've tried to differentiate vagina from vulva. In my previous video, you can see it. But the outside part is the vulva. But many times, why we say vulva vagina is because the Candida will come out. It will be on the skin outside or the vulva. So that's why many times we say vulva vagina candidiasis, because it will be in the vulva, which is outside. It will also be in the vagina, which is inside. Some women, how do they know? It's because when they have sex with their husband, by the time the husband is bringing out his own private parts, you will see the place will be filled with this creamy white discharge on it, and they've now come to the hospital to get treatment. So what I'm saying is that we have not classified vulvovaginal candidiasis as a sexually transmitted infections. And the reason is because you can get it through other means. You can see all the things that I've talked about that can make people to have that. Vulvovaginal candidiasis. So it's not only sex. So that's why we have not said, sexually transmitted infections. But people can get vulvovaginal candidiasis by having sex. So which means if you have sex with somebody with vulvovaginal candidiasis, you too can also have it. That's what we are trying to say. And many times this thing, like in men and women, thing that normally happen with the woman's vulvovaginal candidiasis, maybe she got treated, but that thing might be on the husband private part. By the time they have sex again, the person will introduce that candida again to her own vagina. She will come down again with vulvovaginal candidiasis. So a lot of women have this thing because it can really be very irritating and it can have discomfort, especially if it's associated with itching. We have seen women that because of this vulvovaginal candidiasis, they have the discharge, they are itching, and they have started scratching their vulva. And eventually they start having wounds, and it can be very bad. They can't work very well. So if you have seen any of these symptoms that I've talked about, or you feel you have this, come to the hospital to get treated, so that, especially if you have recurrence, because that can be a pointer to something else in your body. So if you have any question on this slide or on other things that I've talked about, you can contact me on my Gmail, Dr. Tinuade, talking about sexually transmitted infections 023@gmail.com. I will take that again. Dr. Tinuade, talking about sexually transmitted infections 023@gmail.com. Or you can message me on my messenger on Facebook. Actually, some people have done that in the past. I will reply your messages. And if you want to come to the clinic, you can always also send me a mail. I will link you to the right place. Before then, I love you. Bye.